Eat more fiber. How many times have you heard that? Well, do you really understand why you should eat more fiber and what that even looks like? If so, keep listening. That is what we are going to talk about today. The recommended daily intake for women is 25 grams a day, and for men it is 38. The average American is eating just 15 grams of fiber a day, so that's less than half of the recommendation. And did you know that hunter and gatherer tribes are eating 100 plus grams a day? And they have much lower rates of chronic illnesses than we experience here in the United States. So there's something to the nutrition prevention for chronic disease suggestions. And today we're gonna just dive right into fiber and talk about everything fiber related. So let's start by talking about what exactly is dietary fiber. Dietary fiber are these plant compounds that the human body cannot digest and absorb. So it goes through the stomach, the small intestine, to the large intestine, where some fermentation happens, which we're going to talk about, but then it comes out in stool and it's known as bulk. There are a couple forms of fiber that we are going to talk about today, and that is soluble fiber and insoluble fiber. So soluble fiber can dissolve in water, and they're fermented by all those bacteria in our large intestine. If you've missed the other videos, I'll just remind and review that most of our bacteria are in our large intestine. The intestinal tract goes esophagus, stomach, small intestine, large intestine. Small intestine has some bacteria, but there's about, in our body, 10 times as many bacteria as human cells, and most in the large intestine. So that fiber passes, through our mouth, esophagus, stomach, small intestine, mostly, broken down a bit, but mostly intact, where it then gets to the large intestine, and these bacteria ferment it and produce all these compounds that are really beneficial for our body, like butyrate, which is a short chain fatty acid, and it's very anti-inflammatory, so really great as we're kind of coming into cold and flu season here. So soluble fiber, again, gel-like, can create some bulk. Some types of soluble fiber include pectins, psyllium, gums, and resistant starch. And then some foods that contain these soluble fibers include oatmeal, apples, bananas, beans, lentils, nuts, and seeds. There are many others, but those are just some examples. So insoluble fibers, on the other hand, do not dissolve in water, and they're not fermented by the gut bacteria. So examples of these insoluble fibers include celluloses, lignans, and then some hemicelluloses. Some food examples of insoluble fibers include barley, whole grains, and root vegetables like cauliflower, green beans, potatoes, and many more. So apples, for example, are a good source of fiber, and they contain both soluble and insoluble. So the core, the inside, that white part of the apple, is mostly soluble fiber, and then the skin, the outside, is mostly insoluble. Now, there's a lot more fiber in the skin than the inside, so something most people don't know is that if they're cutting the skin off of the apple, they are greatly reducing the total amount of fiber that they are getting from eating that apple. Berries like raspberries, blackberries, and strawberries are also a very high and good source for soluble fiber, and they also have a low content of digestible carbs. So incorporating these into cereals and into smoothies can be a really easy and great idea. You can buy frozen, which is often much easier in the winter time. Another great way to get fiber is to incorporate more broccoli. So a fun fact about broccoli is that the stalks actually contain more fiber than the floret part. So both parts have fiber, but not in an equal amount. So that's why when you eat both parts of it, especially the stalk of the broccoli, you're gonna have a much easier time reaching that goal fiber of 25 grams for women, 38 for men. Much higher is likely just much more beneficial, as mentioned at the beginning of this video. So now let's talk about how much fiber is in specific foods. And I have it written down here just because I want to make sure I get you guys good information. So 1 cup of raspberries has about 8 grams of fiber. So more berries, better. They can range between 4 to 8 grams for a cup. Apple with the skin has about 4.4 grams. A cup of black beans has about 15 grams of fiber. Their beans have a similar fiber content, like chickpeas have 12 grams, kidney beans 16 grams, pinto beans 15 grams. So if you do okay eating beans, this could be a really good source of fiber for you. 1 cup of broccoli has 5 grams of fiber. Other vegetables have about a similar content, like Brussels sprouts has 6 grams, green beans 4 grams, asparagus 4 grams, and that's for a cup. And then 1 baked potato has about 4 grams of fiber, and you could also do sweet potatoes, which have 4 grams. Now, the most commonly eaten vegetable in the United States, you know it, it's potatoes. So I usually discourage people from having potato be their go-to, just because we want to get a variety of different colors and different nutrients, antioxidants, vitamins, minerals from the variety of vegetables versus just meeting our fiber needs with 1 vegetable. So at the end of the day, knowing what foods have soluble fiber, what insoluble, it's interesting, but the best thing for overall health is just to meet those total fiber goals. And if you're eating a variety of foods, you're gonna be getting a variety of different fiber types, which is the end goal. So just think of some different creative ways on how you can incorporate more fiber. For example, in the morning, if you always have a glass of orange juice, consider just having a whole orange, and you're going to be getting a lot more fiber from that whole orange, and it's also going to decrease the spikes to your blood sugar and insulin hormone when you're eating the whole fruit versus the juicified form of the fruit. Sometimes if people are hungry on their way home from work often, I'll recommend just keeping some vegetable snacks in their car. So you can do like a pre-washed bag of broccoli or carrots. And I know usually we want to sit down and be really mindful of eating, but sometimes that's just not the case for what people have going on in their life. So at least, you know, getting in some of the fiber and vegetables during the drive and trying to calmly eat it can be a great way to incorporate more fiber. So another tip I have you ever heard of flax seeds or chia seeds? If not, you can do a quick Google search. I'll put a picture right up here of what these look like. So chia seeds and flax seeds. Well, just 1 tablespoon. So if you don't know, but the tip of your thumb is about a tablespoon. That for chia seeds has about 5.5 grams of fiber, which is a good amount, right? When we're trying to shoot for 25 to 38 grams a day. And then a tablespoon of ground flax has 2 grams of fiber. The thing is, these are really easy to just add to things, to add to smoothies, to sprinkle on top of your salad, or even if you wanted to add a little bit into your soup. So the chia seeds and the flax seeds also have anti-inflammatory fats in them. Grind your flax seeds because then you will have more access to these omega-3 anti-inflammatory fats as well. Okay, now let's talk about the benefits of fiber. What does it actually do? We're gonna start with my favorite topic, digestive health. Have you heard of prebiotics? You know, the food for the probiotics, the friendly bacteria? Well, all prebiotics are considered fiber, but not all fiber is considered a prebiotic. So a lot of the same foods that we just talked about as being a good source of fiber do have some prebiotics, but not all vegetables have prebiotics. Now, I want to say the biggest thing is just getting in more of these fiber sources, and you're going to then be getting these prebiotics. So don't stress too much about specific foods. Try to maintain a big picture, but for the purpose of education, I want to share more specifics about it. So prebiotics, to get classified as a prebiotic, this fiber has to cause growth of the bacteria in our intestine. It has to be able to be used as food by these bacteria to ferment and then create all these great compounds that are beneficial to human health, like the butyrate, like I told you about earlier, that anti-inflammatory short-chain fatty acid. And then it also has to be resistant to stomach acid. So these prebiotics, again, they help to strengthen the bacteria in our gut, and they've actually been shown to help increase the amount of lactic acid bacteria in our intestine, which is a beneficial bacteria. And the more good bacteria you have, then it's going to be able to outcompete the bad bacteria, help prevent us from getting these bacterial infections, or overgrowth of a bad sort of bacteria. So speaking of the immune system, there is actually research to show that it can be very helpful to incorporate fiber during flu and cold season because it can help prevent you from getting sick. So there have been consistent results in different studies which show that fiber causes an increase in serum production of mucosal immunoglobulin and changes in the leukocyte and lymphocyte counts in the blood and spleen. Basically, these really great cells, these white blood cells that just help the body to fight infection, to support and improve our immune system to prevent us from getting sick. And then also, fiber is really important for kind of absorbing some of these, for lack of a better word, toxins that kind of come and get eliminated through our intestines. So for example, it can help to absorb excess estrogen, and then that can get eliminated into the stool. So extra cholesterol, different fats, and then hormones. This fiber can really help to absorb to keep balance. And you'll might know this, but some of the top hormone balancing experts in the country and in the world will even say that for optimal hormone balancing, always get to the source and look at gut health and get digestion and balance first. And this is one of the reasons why. So I also want to add that incorporating fiber when you're already sick is worthwhile too, because it can actually help the body to recover from bacterial infections, is what the research shows. And it does this because those soluble fibers can cause inflammatory immune cells to become anti-inflammatory, and it can also activate these T cells, which just help the body to fight off infections. So now let's talk about how fiber can help with bowel movements. Fiber can add weight and size, so bulk to stool, which can make it easier to pass stool. So if somebody is struggling with constipation, making sure they're meeting their fiber goals is a very first step. Now I want to note that all constipation is not caused simply by a lack of fiber in the diet. There can be other things, but this is a really important intervention to make sure it's happening, because also of all the other benefits of fiber that we've already talked about. If somebody on the other hand is experiencing diarrhea, it's going to still be important to have fiber. Usually, sometimes we want to hold off for different reasons. With our clinic, Oswald Digestive Clinic, we're always personalizing, always looking at what's going on. And for example, in an inflammatory flare, sometimes fiber can be more irritating and we want to hold off on it. But if somebody's just kind of having day-to-day diarrhea, maybe an irritable bowel syndrome that leads to diarrhea, then incorporating more soluble fiber is going to be more helpful to them, because that soluble fiber is going to create more bulk to the stool versus the insoluble, which isn't as bulking as the soluble. So sometimes using a soluble fiber supplement can be helpful. And I know when I've worked in the intensive care units, this is something that we commonly use, Benefiber, to help create some bulk to that loose stool for people who are recovering from trauma and, really sick from that acute, event. But basically with bowel movement, to help keep things going, having enough fiber is very important. So with that, I do want to add that if somebody is struggling with irritable bowel syndrome on more of the constipation side, then adding in more fiber, getting them more regular, having 1 to 3 bowel movements a day, 3 to 4 in the Bristol stool chart. I'll put a photo right there. That can actually improve other symptoms like bloating and gas and abdominal pain, because sometimes those symptoms are a side effect of being constipated. So again, if you're not having 1 to 3 bowel movements a day, definitely work with somebody or incorporate some of what you're learning in these YouTube videos to get you to that spot. My clinic, Oswald Digestive Clinic, we did create a free handout on 5 ways to improve gut health, and that is linked in the description below if you want to click on that link and download that freebie and learn more about this. Okay, now let's talk about the big C word. So cancer, scary, right? Everybody knows somebody who's struggling or who had struggled with cancer. So let's talk about colon cancer in specific, because we do have research showing that how increasing fiber into our eating plans can actually help to decrease our risk of colon cancer. So one researcher from the University of London compiled a large number of studies that had already been done, and he found that between those with the lowest fiber intake and the highest fiber intake, every increase of 10 grams of fiber a day was found to have a 10% reduction in colon cancer risk. So increase of 10 grams of fiber a day, that could be, you'd get more of that from a cup of beans, found to decrease colon cancer risk by 10%. How amazing is that? So he also concluded that by adding 3 servings of fiber to the diet each day, there is a 20% reduction in risk. So 3 servings, you can rewind this video and we'll talk about more of what 3 servings is, but it's not a huge amount. It's for most people totally doable, and maybe having this knowledge now of how much that can reduce your risk of getting colon cancer, maybe that might be some encouragement and motivation to want to work harder at incorporating plants and fiber into your eating plan. So this 3 servings, it can be as simple as 2 fiber-rich fruits a day or 1 fiber-rich vegetable. So maybe have a fruit with breakfast, have a vegetable with lunch, have a vegetable with dinner. You're done. 20% reduction. Let's talk about fiber for weight. So fiber can help us prevent us from being hungry all the time. One mechanism is that it can help to balance out blood sugars, which can help to balance out our insulin hormone, which better glycemic control prevents people from being hungry all the time. It also might be due to some fiber, maybe food is sitting in your stomach for a bit longer, which can help to delay the trickle into your small intestine, and also the absorption, helping with that hormonal balance as well. So as you can see, fiber is really important component of an eating plan. It can be wonders for helping to prevent chronic disease. We talked about how it can help with digestive health, how it supports the body's natural detoxification systems. Our body knows how to detoxify. We just have to make sure that we're giving it the right support so that it's all working proper. And I can tell you that if you're not having a bowel movement every day, your detoxification pathway is not optimized. Also, we talked about how fiber can support the immune system, it can prevent you from getting sick, and then once you are sick, it can help you recover quicker, and then it can help to regulate healthy bowel movements. So especially constipation, getting a variety of fibers. If it's diarrhea, let's kind of hone more into the soluble fiber side of things. And lastly, preventing colon cancer. Up your veggies, 3 servings a day, 20% reduction. So with all this information, I really encourage you to try to at least meet those dietary recommended intakes of 25 grams for women, 38 grams for men. If you're getting 100 grams a day like a lot of tribes do, kudos to you. That is awesome, and you are probably gonna just prevent some of these chronic issues that we're realizing can be stemming from poor nutrition or not optimal nutrition. And so you could start by simply doubling the amount of vegetables that you eat a day, or even just adding 1 vegetable a day. If this is intimidating, if it's intimidating to think about getting 25 grams, 38 grams, just start where you are with 1 thing, maybe berries. Okay, I could do some frozen blueberries. Maybe for an evening snack, maybe you are used to having something at 7 o'clock. We're not gonna talk about, good, bad to that and nighttime eating. That's a whole conversation. It's not always good, not always bad. But if you're hungry at 7 p.m. and you want a little something to eat, or maybe you're having blood sugar issues overnight and you want something before bed to try to help balance those out, try some blueberries with maybe a really good quality heavy whipping cream if you can tolerate dairy, or a coconut cream if you can do that and feel good doing that, or even a little handful of nuts with the berries. It can be something as simple as that. So I'm gonna also put up again that meal plan that I showed you earlier, because I think this is really a great thing for you guys to save and keep on hand. You can see it's not a specific, eat this, eat that. It gives you choices. So hopefully you can go in, put foods that you actually enjoy eating into these different slots and get an idea as to what a day might look like for you with meeting these fiber goals, which is gonna help your gut health. Your gut bacteria are gonna be happy, your immune system's gonna be happy, you're gonna decrease your risk of colon cancer. And that is all things that I think most people want. So I want to thank you for listening. Again, there's some free downloads in the description below, and I hope you're all having a wonderful day, and I hope to see you again very soon.